Hey folks, Dr. Joe here. Hope everybody's having a wonderful day. Lots of good information today. Now, going to put a little warning on this show. We're going to talk about how different diseases actually affect your love life. So if you don't want to hear it, time to change channel. Maybe if there's children in the room, I'm not going to say anything bad and nothing obscene or anything. Don't worry. I'm going to use euphemisms like romance, like things like that. However, I do want to let you know that's our topic today. And the reason is, as I tell you on every show, a lot of people come to our offices. We have 3 offices in the Atlanta area, and they come into us and they tell us their problems. And I always try to base my shows on what I'm seeing a lot of. And it's been a while since we've done a show on this, so I think it's time we visit this and cover diseases, different spin on it, and what different diseases can do to your love life, and then what you need to do about getting that taken care of. Because the problem isn't the symptoms that you're having, the lack of romance, it's the disease that's causing it. And then, of course, we have to dig a little deeper and say, what's the cause of the disease? And that's the whole thing. I always try to get to the cause of your problem and not just treat your symptoms. And if it's the first time you're joining us, welcome. Glad you could be here. I am Dr. Joe Esposito. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. This show is heard coast to coast and around the world. Just found out yesterday we're going to take this show and make a TV show out of it. It's actually going to happen. Finally, Ahmad, right? We've been waiting how long for this?
Too long.
Too long. Many, many years. But it's going to happen on Tough TV, TUFF TV. They're going to start September to October 1st, somewhere we're going to launch. So we're going to start filming this show, and hopefully we'll simulcast it on Facebook or our websites or whatever, and you can see it then too. Get to see my pretty, well, actually you can see Ahmad's pretty face, and you can see my face. So those are 2 different things here. So, but that we just found that out yesterday, literally. So that's kind of exciting. So, so as far as I know, we're the #1 health and wellness radio broadcast. I always said in the country, but I think now we're probably going to be the #1 health and wellness radio broadcast in the world. What do you think, Ahmad? Can we say that?
I would think that'd be a safe assumption.
Who's going to argue with us, right? Because Tough TV is an international show, international station. So that's kind of cool. Anyway, so let's go back to this again. If you're squeamish, if you don't want children to hear this, it's fine. I'm not going to say anything bad. I just want to let you know that's what we're talking about today. So start with diabetes. How many people have diabetes? Raise your hands. A lot of you, I know. #1 reason I see patients, well, medications I see is high blood pressure. #2 is cholesterol, and a close third, probably tied for second, is diabetes. Now, high blood sugar damages the blood vessels, and it damages the nerves over time because sugar is an acid. So what happens is with type 2 diabetes is you eat any type of sugar, breads, cookies, cakes, donuts, pastas, whatever it is, and your pancreas releases something called insulin. Now, insulin goes into the cells and opens up the cells, and it's kind of like a lock that unlocks, it's a key that unlocks the locks that are the cells. So the insulin goes into the cell, kind of turns the key, opens it up, and allows sugar, glucose, to come into the cell. Well, if you have a lot of sugar in your diet, and a lot of people do, you produce a lot more insulin. So the cells eventually cannot take in any more sugar. If they take in any more sugar, they're going to get clogged up. And so the cells basically say, no more sugar, not going to let any more in because it's going to mess up my works. It's going to gunk up the works. And so now the cells become insulin resistant. The insulin is trying to be a key and open up the lock, but the cells are going, I got too much sugar in here. Don't try to let any more in. And insulin resistance is essentially type 2 diabetes. So what happens to the sugar now? Floats around in your blood. That's why you have high blood sugar. Oh, that's what that means. Now, too much sugar in the blood it's an acid and can irritate the blood vessels and actually tear up the blood vessels a little bit. And that can cause the body to lay down cholesterol to kind of fill in the scabs, so to speak, that this sugar has caused, these scratches. And that would be high cholesterol or hardening of the arteries. But too much sugar can also affect the nervous system. Now, the nerves control everything. Nerves control your heart, your lungs, your liver, your spleen, your romantic organs. But too much blood sugar can hinder the flow of blood to your romantic organs because of the hardening of the arteries. Men can have issues, of course. Women can also have problems. They can lose desire. They can have issues being able to stay active. It can cause pain, and it can cause problems with pleasure. So if you control your diabetes, you stay active, you eat right, chances are that your love life is going to respond in a very positive manner. Well, the cool thing about type 2 diabetes is this. Study after study after study has shown that if you cut out your sugar, you stop producing so much insulin, the cells now become resensitized to insulin, and in most cases, and this is many medical studies out there, you can reduce or eliminate the need for medication for type 2 diabetics. Is it challenging? Yes, it is, because you really got to change your diet. You have to do what I've been telling you for the past 35 years. You have to eat more fruits, vegetables, and nuts and seeds. You got to stay away from the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. And as a chiropractor, I always check the nerves in the mid-back on my diabetic patients. And almost 100% of the time, I push on your mid-back and I go, ooh, that's sore. I didn't know that was sore. That's the nerve supply to the pancreas. So the brain can open up the nerve supply to the pancreas. We balance out the sugar, and we do that by eating fruits and vegetables. And if you eat fruits and vegetables, you're going to get a lot more fiber. And fiber is going to slowly push the food through your colon, so you get a slow release of the sugar, which means a little bit of sugar is released into the blood at a time, so the cells are able to handle a little bit. It doesn't do well when you dump a lot in there. So the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweeteners are the 7 deadly sins. The carbohydrate part, and the alcohol and the breads and the pastas, the sugars are the problem when it comes to diabetes. So what do? Well, you can continue taking medication. If you need medication, folks, absolutely positively take it. Don't say, well, Dr. Joe, you're going to fix me. No, you need to take your medication. Then we're going to work with you to try to get you well so you don't need the medication. But I don't want you to stop your medication and assuming that, well, Dr. Joe's the miracle worker and he's going to do everything. No, we have to work together on you. We got to check the nervous system, pinch nerves. Got to check your diet. And we got to make sure that you're eating, that you're digesting your foods as well. If you have acid reflux, heartburn, burping, gas, bloating, that could be signs that there's issues there. Folks, got to go to a break. Lot to talk about. Food, diseases that affect your love life. So if you have a healthcare question, we're going to open up the lines. 844-44-Dr. Joe. Doesn't have to be about romance, about anything. 844-44-Dr. Joe. My website, as of this week, drjoe.com. Didn't even tell you this, Ahmad. drjoe.com. Just go right to drjoe.com, bring you right to our website. Hey, folks, tell your friends about the show. Give us a call if you have a question. 844-44-Dr. Joe. We'll be right back. 444-Dr. Joe. Hey, folks, Dr. Joe here. You there. Oh, stealing it from Mark Aram now. That's my friend Mark Aram there. That's his line. I'm here. You're there. So anyway, glad you could be here today. What we're talking about today are diseases that can adversely affect your love life. And we started talking about diabetes because diabetes is certainly a big issue. And the key to diabetes is getting your cells to utilize sugar or glucose more efficiently. And we do that by not giving them any sugar. And you make them want it. You say, I'm not going to give you any, haha. And then the cells go, all right, I'll let insulin open me up and let more sugar in. So that's what you have to do. And the good news is that once you start doing this, you're going to see the changes. You'll probably lose weight. You'll probably have a lot of energy. You'll start to feel great. And you'll say, I can do this forever. This is not hard. I was talking the other day with a 13-year-old, and we were talking about fast food. And they said, well, fast food is just cheap, and so people can buy a lot of it. And I said, no, wait a minute. Let's do this for a second. I said, you can go to a store, and even if you go non-organic beans, many times you can get cans of beans for 50 cents a can. So if you were to go get a big burger, fries, and a soda, let's assume $5. Okay, let's be cheap, $5. For a big burger, fries, and a soda. That's 10 cans of beans. You couldn't eat 10 cans of beans in one sitting. Now, granted, they should be organic, and they should make sure they don't have bisphenol A in them. But at this point, we're just keeping it cheap. So eating healthy is so much cheaper than eating the cheapest of the junk foods. No, yeah, but Dr. Joe, a burger, fries, and a Coke sure tastes better than a can of beans. I agree with you. Maybe make up some rice. That's cheap, too. And then add some hot sauce to it. That's cheap, too. And so now you're getting a plant-based diet, lots of fiber, lots of nutrients, vitamins, and minerals you're not going to get from burger, fries, and a soda. So it's a lot cheaper if you know what you're doing to eat healthy, and the fiber is going to be the key, especially for this, for diabetes, keeping the sugar low. I remember being in high school and hearing a phrase that there's 3 great pleasures in life: food, romance, and music. And so I thought, it's kind of true. They kind of fit into those 3 categories there. And why would you want to take away so much pleasure in life by eating the bad foods when you could be eating the good foods that are so much cheaper? A lot to talk about. We got some callers. If you have a question, 844-44-Dr. Joe. Let me start taking some callers. Ed, how can we make your day better?
Hey, how you doing, Dr. Joe?
Very good.
I heard you advertising something. This has not anything to do about what you're talking about.
That's quite all right.
Advertising the other day for some kind of stem cell injection or something, goo or something.
Right. Okay. Yeah. Stem cells. Yeah.
But I heard you talking, advertising about a clinic or whatever that did that.
Right.
But I thought I wrote it down right, but evidently I didn't because I tried to look it up.
Yeah, if you call my office, you can give us calls tomorrow at 844-44 Dr. Joe. I can get you that number. I don't have it with me right now. Yeah, but stem cells can be used for a lot of different things, and the research in medicine is kind of going in that direction. And if you're looking at it for joint issues like arthritis, many times they can take stem cells or what's called PRP, protein-rich plasma, and put it right near the arthritic joint. And in time, hopefully, you start to regrow some of that cartilage. But here's the kicker. If the bones are out of alignment, that's what caused the cartilage to wear out to begin with. So I've seen people do stem cells. They start to grow cartilage again, but because the bones are still out of alignment, it wears right out again. So it's like getting your tires fixed. You got to realign the tires so that they stop wearing out.
Well, I went to the Mayo Clinic anyway, and they said I had like 5 discs that are completely wore out in my back.
Uh-huh.
And the kind of surgery it would take to do anything for that they wouldn't recommend to anybody.
Oh, yeah.
So anyway, I don't know if you can do anything about wore out discs.
Oh, absolutely. Yeah, what we do is realign the body, and we put you on a gentle traction machine that opens up the vertebrae and sucks fluid into those discs. Then if we need to do the stem cells as well, that's a combination you'd want to do. Doing the stem cells by themselves without treating the cause of why the discs wore out is a very expensive investment that usually doesn't hold. If we realign everything and do the stem cells, we see much better results. Yeah.
Okay, so I could just call and get an appointment.
Yeah, when you call, we can get you that phone number, make an appointment to come see us. We'll check out your spine as well.
All right, Dr. Joe.
Thanks, Ed. Appreciate the call. Folks, if you have a question like Ed, 844-44 Dr. Joe. And that number, by the way, rings through to my offices when I'm not on the air. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So we're talking today about diseases that can adversely affect your love life because, once again, one of the three great pleasures, food, romance, and music. As with diabetes, the problem with blood vessel damage is the thing that can lead to romantic issues because you have to have blood supply for romance, for men and women. And blood supply creates lubrication, blood supply creates function. So you want to make sure you have a good blood supply, but the thing that's often missing is you got to make sure that you have proper nerve supply. The nerves in the low back, if you have a pinched nerve, can cause back pain, leg pain, hip pain, knee pain, ankle pain. Sounds like you, doesn't it? Leg swelling, cold legs. Those same nerves control your colon, reproductive organs, our topic today, and your bladder. So urinary issues, urinary incontinence, gas, bloating, diarrhea, constipation, romantic issues. You got to check the nerve supply going to the organ, and you got to straighten out your diet to get the proper blood and nerve supply going. And then we got to see what else we got to do. Maybe you're overweight. I used to be very overweight. And when I was overweight, my body produced a lot of estrogen. Estrogen can counteract your concerns when it comes to romance because the fat cells in the body actually produce estrogen. So when it comes to heart disease, you may have to take medication. And some of the medications, like high blood pressure medication, can cause issues as well. So lifestyle changes comes back to it again. Normally functioning nervous system, normally functioning digestive system, and good nutrition. Now, if you've had a heart attack and you worry that romance could trigger another heart attack, it's a good idea to check with your doctors and find out, that's why the commercial always say, are you healthy enough to engage in romance? Well, that's important too. But why would you want to make yourself sick when you know that there's options that might make you better? This is the thing that blows my mind. Was it the UN or the World Environment? Somebody just said that if people went to a plant-based diet, even 50% of their diet, they gave up 50% of their meat, it would solve most of the world's problems with pollution and overcrowding, soil erosion, because all that goes into animal production. Now, if you're going to eat animal products, it's your call. I support you in that decision. I'd recommend you stay away from the ones that have a lot of steroids and hormones and chemicals and pesticides. So you might want to consider organic animal products. And boy, I've been fighting this battle for 35 years now. And finally, you're starting to see restaurants carrying plant-based burgers. You're starting to see restaurants carry grass-fed beef, no antibiotic chickens. So we're winning, folks, and we're going to keep winning. And when we continue to win this battle, you see the world change. But in your case, your world that changes. You start getting better. You start having more energy. You start losing weight. You start feeling better. No downside to getting healthy, folks. If you have a question, give me a call, 844-44-Dr. Joe. My website, drjoe.com. We have hundreds of hours of radio shows, podcasts there. If you go to Stitcher or iTunes or Google Play, look up for my my podcast. It's called For the Health of It. That's the name of my first book, Eating Right for the Health of It. You can listen to the podcast there. We come back and talk about some supplements that you can take to help your love life. Make it real easy for you. Folks, 844-44 Dr. Joe. I'll be right back. 44. Hey, folks, Dr. Joe here. Glad you could be there with me today, and hopefully you're going to learn lots of good things today. We're talking today about certain diseases that can adversely affect your love life. And this is an issue that I see very often with my patients, have for the past 33 years. And patients don't know what to do about it. You know, it can ruin a relationship. And I don't know what to do about it, doc. And so we talk about getting the body functioning normally again. And so we're talking a little bit about heart disease. I want to talk about depression in just a second, but it's going to tie in nicely with my next caller, who is Caroline. How can we make your day better, Caroline?
Hi, Dr. Joe. I have a question for you about a hiatal hernia.
Good.
My father is 86 and a half and was diagnosed with that,
Yep.
and I'm wondering if that's treatable with chiropractic adjustment.
I see that in probably about 80% of our patients. Now, it may not be a full-blown hiatal hernia. It may be what's called subclinical, meaning they have the symptoms, but you can do an endoscope and we don't see anything. But many times the stomach will push up against the diaphragm. You have a sheet of muscle called the diaphragm, and the stomach pushes up against the diaphragm, and you're not able to digest your food properly, so the food refluxes up into the throat. And so you might have gas, bloating, acid reflux, heartburn, chronic cough, sinus problems. All this can come from hiatal hernia or, you know, symptoms like it. So what we do is we can actually adjust the stomach. We take the stomach, we massage it, we gently pull it down away from the diaphragm. And when we do that and it stays there, life is a whole new thing. Because now, for the first time in a long time, you're digesting your food. And you're absorbing your proteins. You're absorbing what's called your amino acids more efficiently. And so the gas, the bloating, the acid reflux starts to go away. And the danger is if acid keeps coming up into your throat, you can develop esophageal cancer.
Right.
So it's not a game to play with. So the answer is we see it, I wouldn't say every day, probably every 15, 20 minutes in our offices. Yeah, very common.
Because he's also been diagnosed with a pouch. And in his, right near the trachea and the esophagus there.
Sure. Mm-hmm.
And so he's had a lot of issues with that.
Sure.
And he's had multiple myeloma, so, his bones are delicate. Yeah, but he's doing pretty well because he was diagnosed when he was 80, and he's 86 and a half. So
good. Excellent then, okay.
But so you can do a chiropractic adjustment, or you adjust the muscles?
We would work on the spine. We want to open up the nerve supply to the stomach, and then we check the stomach itself, and then actually work to massage the stomach down away from the diaphragm. Yeah.
Okay.
Okay.
All right.
Yeah, so the number you call, 844-44 Dr. Joe. Just call when we're not on the air. You can make an appointment. We'll get him in. We'll get him in as soon as possible.
Okay.
Thanks
so
much.
much.
Appreciate the call. And now, what did that have to do with depression? Well, what happens is your stomach's job is to take proteins and break them into something called amino acids. And amino acid tryptophan goes up into your brain and becomes a neurotransmitter called serotonin. And tyrosine becomes dopamine, which is the neurotransmitter that gives you pleasure, kind of tying into today's topic there. And glutamine becomes GABA, which helps suppress pain. So you have to have good digestion in order to break the food down so you can absorb the nutrients in order to make the brain work. And so a lot of patients come into our office, symptoms of depression, one of them being loss of romantic drive. And we can try to treat the symptom, which is the depression, or we can try to get to the cause. So there's several things I deal with, or we deal with, my team of doctors deal with, when it comes to emotional issues. We check the nerve supply and the blood supply in the neck that goes up into the head, because pinched nerves or pinched blood vessels in the neck can cause brain malfunction. Your brain needs three things. It needs oxygen, stimulation, and nutrition. And if you're not giving it oxygen, stimulation, and nutrition, it's not going to work right. So pinched nerves and pinched blood vessels can prevent oxygen and stimulation from getting to the brain. If you have acid reflux or heartburn, you're not breaking the proteins into amino acids. You're not giving your body the raw materials to produce the neurotransmitters. So that's where digestion comes in. So people that have emotional disorders, I was going to say a patient's name there for a second. I can't do that on the air. You have to get the digestive system working. And then you have to give them easy to digest proteins. So if you're eating cooked meat as a protein source, or fish or eggs, once you cook them, you destroy the enzymes. And so the animal, it's really not as bioavailable. It's not available to you as a plant-based protein would be. because if you cook the plant-based proteins, yes, you destroy some of the enzymes, but it's easier to absorb, break down, and absorb. So you got to start thinking about the source of your protein. The hardest protein to digest is animal products. Now, if you're going to do it, it's your call. Whatever you decide to do is up to you. But give my thoughts a shot. See if I'm right. And if I'm right, cool. If I'm wrong, so what? I'm wrong. I'm not wrong, though. And so we got to get the body on easily to assimilate food. If you have the acid reflux, the heartburn, sometimes called a hiatal hernia, we may need to pull the stomach down away from the diaphragm so that the stomach can break proteins into amino acids. Tryptophan becomes serotonin. Tyrosine becomes dopamine. And now we give you raw foods as part of your diet as well, because raw foods have something in it called enzymes. And enzymes help break down your food and absorb them. So that's why I say at every meal you should have something raw. Maybe it's broccoli, cucumbers, tomatoes, avocados, watermelon, salad. One meal a day should always be a salad anyway. And then I take something called Dr. Joe's Super Greens and Dr. Joe's Essential Source. These are 2 powders. Most of it is raw. And it's fruits and vegetables in about 17 different types of fruits and vegetables in a powder form. Then we add prebiotics, probiotics, digestive enzymes, and a complete multivitamin. And then the Super Greens has chlorella and spirulina in it. And spirulina now, a lot of research coming out on spirulina that's used for muscle function, blood function, cancer treatments, not saying it's a cure for cancer. So I've put all the stuff that you need, the minimum amount of nutrients in a day in Super Greens and Essential Source. Then if we do have digestive problems, I usually put people on Dr. Joe's Digestive Enzymes as well. That's another supplement. They're all on my website, by the way, drjoe.com. Or you can just go to Amazon. If you have an Amazon page, you can order it there too. But the minimum amount of nutrients you should be taking in every day. Dr. Joe's Super Greens, Dr. Joe's Essential Source. And then if we need to, we add things like digestive enzymes, adrenal support. You know, your adrenal glands produce sex hormones, not just your reproductive organs. But your adrenal glands produce testosterone, estrogen, progesterone. And so if you have bags under your eyes, if you're tired all the time, if you're just worn out, if you drink a lot of stimulants like coffees and teas and chocolates, chances are your adrenals are pooped. And we might need to get you on an adrenal support. I take adrenal support every day. I take digestive enzymes every day. And it's really cool because in order to break down fat, you have to have an enzyme called lipase. Lipase breaks down fat. So if you're eating cooked foods constantly, your body can only produce so much lipase. And as you get older, you produce less and less. So part of a weight loss protocol that I put my patients on, myself included, I used to be overweight, is I'll put them on digestive enzymes. And I give it to them between meals. So if you take it with meal, it helps digest the food. If you take it between meals, it gets absorbed into your blood system, and then the lipase is able to do its thing, which is kind of cool, which helps break down fat. So one of the reasons when people hit the wall, so to speak, when they can't lose weight, it may be that they're just not getting enough enzymes. Once again, more raw food. Broccoli, cucumbers, tomatoes, avocado, salad, things like that. It's pretty cool. Folks, if you have a healthcare question, lines are open, 844-44-Dr. If you want to order Super Greens and Essential Source and Digestive Enzymes and read my books and listen to my blogs, go to my website, drjoeesposito.com, or just Google Dr. Joe, #1 Dr. Joe in the world. Supplements and books are also available on Amazon. Listen to my podcast. We videotape my live lectures, too. Oh, by the way, sign up for my newsletter on my website, because a lot of times we have live lectures. I have one coming up in a couple of weeks. We give out free tickets to a lot of our live lectures. Some of them are free anyway, but if it's not a free one, I give you free tickets. How about that? So the website's there, drjoe.com. The phone number here at the studio, 844-44-Dr. Hey, tell your friends about the show. I'll be right back. Hey, tell your friends about the show. Hey, everybody, thanks for being here. I am Dr. Joe, and today we're talking about diseases that can adversely affect your love life. Now, we're keeping it clean, so if you have children you don't want to hear this, that's fine, but we're keeping it clean and we're keeping it scientific. But you need to know about these things because this is a big issue, and a lot of people are too embarrassed or don't know who to ask when it comes to these concerns. And a lot of patients, once they get to know my doctors, they trust them, and they'll open up and say, hey, since my heart attack or since I have high blood pressure or since my diabetes, we're having some problems in the romantic department. And so then we're able to sit down with the patient and say, listen, let's check some things. Let's check the nerve supply, make sure there's no pinched nerves. Again, we're chiropractors, so we always check the nerve supply. And let's check your diet. A lot of things can cause problems. If you eat a lot of sugar, for example, okay, if you eat a lot of sugar, just table sugar, 50% glucose, 50% fructose. Fructose, when it gets into your liver, converts into uric acid, which gets in your joints and it hurts. So as chiropractors, of course, we want to get you out of pain. But the uric acid prevents nitric oxide production. Nitric oxide production opens up your blood vessels and increases circulation. So a lot of people have circulatory issues, hardening the arteries, romantic issues, memory issues. We're finding out that Alzheimer's is probably a circulatory disease, because when we do autopsies on people with Alzheimer's, and essentially 100% of them, there's clogged arteries in the brain. People without Alzheimer's, they don't have clogged arteries. Now, is there cause and effect? Research is ongoing right now. But you certainly want good blood supply up into your brain, because your brain needs, what did we say earlier? Oxygen, stimulation, and nutrition. So nitric oxide is extremely important to open up those blood vessels, which can then lower your blood pressure as well, but increase circulation to your brain and your romantic department. There's a supplement we created. It's called Dr. Joe's Nitric Oxide Support. And when you take it, it converts into nitric oxide and opens up your blood vessels. So a lot of people, I created it more for circulation to the brain, actually, but a lot of people coming back and saying, Dr. Joe, this stuff is like, oh, it's a youth pill. I'm feeling very frisky and functioning like I'm a lot younger, too, because we're opening up the blood supply. So lots of folks are loving the nitric oxide support, and it really wasn't my intention to do that. But, hey, if it opens up blood supply to places it needs to go, I'm 100% in favor of that. All right, let's take another caller. If you have a question, 844-44-DR-JOE, 844-44-DRJOE. Tony, how can we make your day better?
Yes, about 2 months ago, I was diagnosed. I thought I had sleep apnea, but after numerous studies, it was found that it was silent reflux. And as a result, I had created a very thick mucus on my throat.
Yes.
So the doctor put me on omeprazole and a strict diet, which I'm very healthy otherwise. And I followed that strict diet, cut out the caffeine, the coffee, sodas, everything. And I'm still having issues, not as bad as 2 months ago, but I'm still having issues with it when I get off the pill.
Sure, I understand. Yeah, and the problem if you're taking, and again, I'm not against you taking medicine. I say that every show. But if you're taking a medication to help reduce stomach acid for the silent hiatal hernia, the silent acid reflux, that's also preventing you from absorbing calcium, B12, iron, and magnesium, which you need. And also you need stomach acid, because stomach acid breaks down your proteins into amino acids. So in cases like yours, and like I said, we see cases like yours literally every day, many, many times a day, we need to take the stomach and gently massage it or pull it down away from the diaphragm so that it relaxes so that you can start digesting your food again. And it's extremely common. I had what you had for years. I had a rapid heart rate. I had a regular heart rate. I was anxious all the time, didn't know why. Finally, I was maybe 10, 15 years ago, I was adjusting one of my patients in the second adjusting room in my office, and this light bulb went out of my head. I went, you need to move the stomach. So I grabbed one of my doctors. I said, take my stomach and do this. And I showed them what I wanted. And for the first time in my life, I didn't have stomach pain. I always had some or more, but I never had none. And now I have no stomach pain, no more acid reflux, no more rapid heart rate. Works pretty well. So you probably have a physical problem, Tony, not a chemical problem. So you might want to come see us and let us check that out for you.
I will. Thank you so much.
Thanks, Tony. I appreciate it. And, folks, if you do want to make an appointment or you have questions, the number at my office is also 844-44-Dr. Joe. And you could call us if you have questions, make an appointment. If you have questions, a lot of people always call up, do we accept insurance? The answer is yes, most insurances. Some of them we don't accept, and like all doctors are now, they're dropping out of the networks because they can't afford to stay in the network. There's a political twist to healthcare that nobody's talking about, and it's that the insurance companies aren't paying enough for the doctors to actually make a living. They're actually losing money. There was one network, we were losing money when we were seeing patients. So we'll drop out, but many times they have out-of-network benefits, not just for us, but for all doctors. And so don't, oh, I don't see you on my list of doctors, I'm not going to come. Let us check the insurance. And even if you don't have insurance, you don't have coverage, I should say, it's still extremely affordable to get treatment and get well. And I'm always amazed at patients, well, my insurance doesn't cover it, I'm not going to get the treatment. So what are you going to do, die? I'll show that insurance company. I'm going to die before I go to a doctor who is in my network. It's ridiculous, folks. And I don't want you to think, I want you to think this is your life. And how much is it worth? And it's not very expensive. It's relatively inexpensive to get well and stay well. And once you are well, it's really inexpensive. I was talking to a friend of mine today, and she said she can't believe how little she spends on groceries. She goes, I can go out to dinner once, and with that same amount of money, $15, $20, I can buy groceries for several days. Good, healthy groceries. She's a vegetarian, so it makes it real easy. God, it's so cheap to be a vegetarian. My God, folks, if nothing else, do it to save money. But you can buy lettuces, and you can buy carrots and celery and broccoli and avocados and tomatoes and cucumbers and make hummus. You know, you can go to a thrift store and get yourself a food processor for $8, $10, and you can make hummus instead of spending $4 for a container of hummus. It costs you about $1.10. And it's fresh, and it doesn't have preservatives in it, and it tastes so much better. If you don't know what to make, the first book I wrote was called Eating Right for the Health of It. And in that book, we teach you how to change your diet. And the second half of the book is well over 200 recipes. And those recipes, I won a national award, actually an international contest for the best vegan fettuccine Alfredo in the world. Won $1,000 for that. It's pretty cool. So I'm an award winner. So that book's available on my website too, drjoeesposito.com. drjoe.com. Thank you, Ahmad, for correcting me. It's drjoe.com. The Dr. Joe Esposito, by the way, still works, but we just got drjoe.com. Also available on Amazon too, and the supplements are there: the Super Greens, the Essential Source, the Omega-3s, the probiotics, the adrenal support. All of those are on the website. And I am such a huge fan of supplements. I take a handful of supplements every day. I certainly take the Super Greens and the Essential Source at least once a day. I have it sitting here in the studio with me right now. And it's funny, patients will come in and say, Doc, I'm tired today. I missed my Super Greens and Essential Source. Oh, I forgot. I ran out of the house without taking them. So it becomes part of your life. Once you start feeling good, and you'll be amazed how much more fun it is to be healthy. Folks, we're talking today about how different diseases affect your love life. So if you have any healthcare questions, not just about your love life, any healthcare questions, 844-44-Dr. Once again, that number rings through to my offices when I'm not on the air. We have, in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We'd love to have you as a patient. If you just questions, you can go to my website and send me questions to drjoe.com. Hey, folks, do me a favor. Tell your friends about the show. Give us a call if you have questions. Don't go anywhere. We're going to be right back. Go anywhere. Hey, folks, Dr. Joe here. Glad you could join me today. Hope you're having a nice day. I'm having a great day. And important topic today. We're talking about how certain diseases can adversely affect your love life, and then steps that you can take to help deal with it. Because many times relationships fall apart when one of the partners gets sick and you don't know what to do about it. And one of the reasons is that the romance is gone. So again, we're trying to keep it clean here. So if you have kids listening, you know, we're going to keep it clean. But if you're not comfortable, I totally understand that too. So let's go right on to cancer. And if you have a healthcare question, by the way, lines are open, 844-44-Dr. Joe, 844-44-DRJOE. Now, romance may be the last thing on your mind if you have cancer. And when you're ready to be romantic, the disease and some of the treatments can make it much more difficult. Chemo, for example, can make you sick and can make you feel very weak. New studies out just today, as a matter of fact, are showing that a lot of cancer patients, breast cancer patients, maybe need less treatment than they've been getting, which is really exciting. I was happy to read that study. You might have pain from the cancer. Hormone therapies can affect your romantic drive. You may have surgeries that can affect your body image. That's certainly an issue too. So you want to connect maybe in other ways when it comes to a partnership. And then when you're more comfortable for the romance, that's great. Now, if a partner wants romance and the other one isn't willing, of course, that's not a good situation to be in. And maybe the partner is just sick, and that's not really a time for romance. Romance is a parasympathetic function. There's two types of nerves in your body. One speeds you up, called the sympathetics, and one slows you down, called the parasympathetics. So romance is a parasympathetic function. You need to be relaxed. You need to be comfortable. You need to be safe. And if you're stressed out or if you're on medication, you may be in a sympathetic mode. Your body may be racing. Sympathetic is, right now, I'm in a sympathetic mode. I'm thinking, I'm on radio, I'm working. If you're stressed out, if you're dealing with family relationships, you're stuck in traffic, that's not really a parasympathetic function. Going to the bathroom is a parasympathetic function. Sleep is a parasympathetic function. So trying to shift from the sympathetic mode to the parasympathetic mode can be challenging sometimes. So there are certain tips you might want to consider as well. One of them would be you want to try to stimulate your parasympathetics. Well, how can you do that? Well, getting your shoulders massaged. The nerve, the spinal accessory nerve that controls your trapezius muscle, your shoulder muscles, stimulates, when you rub the shoulder, stimulates the parasympathetic nervous system. That's why getting your shoulders rubbed feels so good. You know, getting your elbow rubbed is nice, but it's not a parasympathetic innervation. Putting warm towels across your belly. Heat will help stimulate the digestive system, which will stimulate the parasympathetics. So those are some things that if you're always in a sympathetic mode, and this is not just for romance, but if you're always stressed out, you're always, type A personality, racing around, you might want to consider trying to downshift into the parasympathetic mode. It's much healthier because the body heals when it's in the parasympathetic mode. It doesn't heal as well in the sympathetic mode. And romance being parasympathetic, little tricks you can do to kick in the parasympathetics. Chronic pain. As a chiropractor, of course, I think I'm the only chiropractor in the state board certified in pain management. I'm not sure. There might be one or two of us out there. So I get a lot of pain patients in our office, and a lot of pain clinics will even send us patients. One of the big hospitals, teaching hospitals near my office, now sends us pain patients because they're like, we don't know what else to do. You know, we do cryoablation, we can freeze the nerve, we can damage, can kill the nerve, inject the nerve, but it doesn't solve the problem. It treats the symptom. And hey, if you need cryoablation, if you need some type of work to deal with pain management, I support that 100%. But in the meantime, let's also try to get to the cause of the pain. And many times, it's something as simple as a pinched nerve. And this is the thing, too. I covered for a friend of mine last week, a couple of days ago. And somebody called in and said, my husband went to a chiropractor, and the first adjustment was good. And the second one, his neck hurt, so he didn't go back. And I said, now, most people don't marry the first person they date. They may have bad experiences with dating. You don't give up on dating. You may get food poisoning. You don't give up on food. It takes time to change the structure of the body. And I said, if your husband isn't comfortable going back to that doctor, go back to some chiropractor and get the work done. Most of the time, patients are thrilled with their treatment. But the issues that I see with chiropractic patients, talking to my colleagues, is that patients don't follow the advice. They don't do what they're supposed to do. Well, I went twice and it's still there. How long have you had the problem? 27 years. Folks, nobody's that good. It's going to take time to make the changes. So don't jump ship too soon. And I also tell my patients, even after the pain goes away, you still may have some structural issues. And the structural issues need to be treated until the spine is straight, the shoulders are in place. So if you give up sooner than the doctor says, and that goes for physical therapy or medication, you may not be getting the results you want, and it's not the doctor's fault, it's your fault. Got to take some responsibility. So for chronic pain patients, if you're in pain, you're a sympathetic mode, the last thing you're thinking about is romance. If you have pain that just won't quit, you might have to take medications for it, and sometimes the medications can have adverse effect on your romantic desire because they affect your nervous system. Somebody asked me just today, unfortunately, they had a relative of a friend die from opioids, and they said they just saw him 3 months ago, and he was fine. He looked good, and he recently died, young guy, like in his 30s, and he died of opioid overdose, and she said, how do you die from taking opioids? Well, opioids block the pain in your nervous system. Well, they also block the nerves that control everything, your heart, your lungs, your liver, your spleen. So one of the reasons people die from opioids is that they just don't get enough nerve impulses from the brain to the heart or to the lungs, and the heart just stops, and then you die. And that's where this opioid crisis is that's why it's such an important issue, because you don't know how many opioids it's going to take to stop your heart. No one does. And so it's a big risk. And once you start taking them, it's really hard to come off them for some people. This is why we try to get to the cause of the pain. And if you are on pain medications, a lot of doctors send us their patients to say, Doc, I'm getting worried. I don't know what else to do for them. We're running out of medications to give them. We got to get them off these opioids. Can you try to get to the cause of the pain? And then my doctors say yes, and we do everything we can to try to make that happen. All right, folks, got to go to break. If you have a healthcare question, give us a call, 844-44-Dr. Joe. My supplements, Dr. Joe's Super Greens, Dr. Joe's Essential Source. Folks, if you're not taking them, try them. Do it at least for a month, and once you start taking them, you're going to be most likely thrilled, and it'll become part of your new life. My books, my supplements, my podcasts are on my website, drjoe.com, also available on Amazon if you want to put orders in there. But get on something. Start taking some nutrition into your body so you can actually see what happens when your body's healthy. Phone number here at the studio, 844-44-Dr. Joe. Give us a call with your healthcare questions. We'll be right back. Hey, folks, Dr. Joe here. Glad you could spend a little time with me today. We're talking about diseases, certain diseases, and how they can affect your love life. I got a couple of callers on hold. Folks, if you're on hold, keep holding. If you have a question, 844-44-Dr. Joe. I want to cover a few things here and then start taking calls again. Condition that can affect your love life. How about arthritis? Sore joints and arthritis symptoms can cause you to, put a little cramp in your love life, let's put it that way. But you can do things about it. For example, do you know why you have osteoarthritis? I bet you no one's ever said to you have osteoarthritis. Disc degeneration, worn out discs, spondylosis, DJD, it's all the same thing. And patients come in our office every day, offices, and they say, well, Dr. Joe, or I actually talk to usually my other doctors, and they'll say, Dr. Kat, Dr. Irwin, Dr. Gail, Dr. Dave, I have degenerative disc conditions in my back. Okay, do you know why? No. I just have it. I had an x-ray, I had an MRI, it shows it. The reason your joints wear out is because bones are out of alignment. It's a physical problem. And so many times we try to treat the physical problems chemically. If the tires on your car are out of alignment, you don't change the oil, you realign the tires. So if you've got bones out of place, you want to realign the bones. Makes sense, doesn't it? And so osteoarthritis is a mechanical problem. So many times we can take painkillers, and I'm not against that. Acetaminophen helps with pain, and ibuprofen helps with inflammation, and I'm not against you doing that. But getting to the cause of the problem is really my ultimate goal. So if you have arthritic pain, you can make plans for romance. You can try to figure out when you feel your best. Sometimes people wake up in worse pain. Sometimes pain gets worse throughout the day. Make sure you support your joints. Make sure you're not doing things that are crazy that can put too much stress on the joints. Massage oftentimes helps to get circulation into it. Dr. Joe's nitric oxide support increases circulation to the body. That might be something you might want to consider. Certainly alkalizing the system. If you have a lot of acid in your body, acid can get into the joints, and that can cause problems. So if you're eating what we call the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, these are acid foods. So ask yourself, is that donut worth giving up romance? I don't think the answer is yes. I don't think any food would be worth that. But getting your body more alkaline helps bring down the inflammation. Dr. Joe's Super Greens, Dr. Joe's Essential Source, spectacular ways to alkalize your system, loaded with minerals that neutralize acids. It's one of the many, many, many benefits of taking Super Greens and Essential Source. It's one of the reasons I take it at least once a day. So get the acid out of the joints and stop that irritation of the joints. And that should help tremendously. But the goal is going to be to realign the joints. That's the ultimate goal, to get to the cause of the problem, not just treat the symptoms. I'm going to talk about testosterone and menopause in just a second. Let's go to the callers first. Marty, how can we make your day better?
So, Dr. Joe, I hear you talking about the opioids.
Opioids, yeah.
I've had back problems. I got one disc that's torn and 2 that are swollen. They're not, they're not something they can. There's no leakage or anything.
Understood.
I think I've been on. My doctor has me on fentanyl and Dilaudid. I've been on for about 6 years.
Sure. Mm-hmm.
And I've tried epidural, trigger points.
Right. Mm-hmm.
Of course, I get a lot of doctors look at me and they see what I'm on, the fentanyl and the Dilaudid, and they think, that's too dangerous. It's going to cause problems. But it's not like there's any other option. I've not had anybody tell me there's a real big fix except for surgery. And the surgeon told me, you don't want to cut open your back. If you're able to walk and make do, you don't want to start cutting your back open unless you're,
right,
to that extreme.
That's a smart surgeon, yes.
So, I guess my scare is, the opioid, I've been on it for so long. I worry that eventually I'm going to get to a point where I don't know if they're not going to work, or and I haven't overtaken over the years. I haven't had that problem where I need to overtake.
Right.
But it's still, the fentanyl, it's scary.
You can start getting used to it. So, yeah. Have you tried chiropractic care?
I tried once, didn't work, and my doctor that gives me injections told me, I guess I looked at the MRI and said, it's not going to help you, and that's going to make it worse. So,
okay. Well, once again, I don't recommend surgery. I'll send you to a surgeon to see if you need surgery, and so I'll respectfully disagree with your doctor. Now, it may not work. I don't know that. But it's extremely rare we find a patient who that chiropractic doesn't work with. The only time we have problems is, like I said, they don't follow their treatment plan. I came in twice, it didn't work. Well, it's not a fair statement,
So let me ask you one thing. I saw one surgeon once, and he told me he wouldn't look. He said he would not look any further until I completely wean myself off the medications.
Right. Mm-hmm.
And I said, well, but then I'm not functional. I have to be.
Right.
So it's like that's a catch-22. What am I going to do? I can't. I still work through this stuff.
Sure. In fact, one of the insurance companies, one of the big insurance companies, had a meeting with the Georgia Chiropractic Association, and they want to start driving their back pain patients to chiropractors first. And the reason is not that they are so concerned about you; it's cheaper. Their big concern is, wait a minute, chiropractic care is a fraction of the cost with better results for most back care patients. Why don't we send them to chiropractors first? So you're seeing the trend going. Like I said, a lot of major universities and hospitals now are sending us and other chiropractors pain patients because if somebody's on opioids, that doesn't look good on their records. And if somebody dies, it really looks bad on their records. You know, they have a track record. And they don't – their main concern is we got to keep our records looking good.
So if you have a torn – like in my case, swollen disc, I know if you actually have a torn disc, is that anything to do with it, or is that pretty much –
No, we could try that, and then you might want to consider stem cells as well. Like I said, I take patients, try to realign everything, and if we still have some residual issues, then I can send them out for stem cell injections, and the stem cells can hopefully regenerate some of that. And if it doesn't work, it didn't work. But if it does work,
how does that? How do you go to stem cell? I mean, nobody's ever told me about that one. How do I?
Oh, there you go. Well, if you come into our offices, we can do an evaluation with you and see where we are from a structural standpoint. The reason things tear is because they misalign. So you got to get all the alignment lined up as well.
Yeah.
And stem cell doctors send us their patients so that we work together with them. And then we can send you out for a stem cell evaluation, see if this is something they think that would work. And there's different types. There's umbilical stem cells from umbilical cords from babies. They take your own PRP. They take your own stem cells out and re-inject them. So there's different ways to go around it. But once we meet with the patient, then we can kind of advise you as to what we would think would be the best approach. But if it doesn't work, it doesn't work. So what? You're still in pain. If it does work, you're going to be really happy with the results. And it actually can regenerate the
I know the side effects. It affects my eye vision. It affects my thought, my memory, everything. I get all the side effects, which I relate to that medicine. That's what's causing my memory issue and my vision problems.
Of course. I mean, I remember I did steroids once for poison ivy, and man, I was grumpy as heck. I couldn't remember anything, so I can't imagine 6 years of it. Wow. Yeah, so if you want to come see us, let's see if we can do it. And it's worth a shot. If it doesn't work, it doesn't work, but chances are it'll work. So that's great.
So how do I just look up Dr. Joe?
drjoe.com or 844-44-Dr. Joe. The number you dialed will get you through to my offices when I'm not on the air, and then we can set you up a time.
Okay.
All right, Marty?
All right, great.
I look forward to meeting you. Thanks, Marty.
All right.
Yeah, and folks, the number 844-44-Dr. Joe does ring through to my offices when I'm not on the air. But if you have a question, give us a call. Almost up against a break here. So when we come back, we're going to talk about testosterone, hormone levels, menopause. If we have time, we'll talk about multiple sclerosis and pseudo-multiple sclerosis. There is something that a lot of you are taking every single day that mimics the symptoms of multiple sclerosis, and you don't even know it. Folks, got to go to break. If you have a healthcare question, 844-44-Dr. Joe. My website, drjoe.com, or just Google Dr. Joe. Of course, we come up first. And if you want to get Dr. Joe Super Greens, Essential Source, the adrenal support, the probiotics, we have a bunch of supplements there. You can get them there as well. If you have questions, send them to me through my website, drjoeesposito.com, because we want to help you get well and stay well. Hey, don't go anywhere. Tell your friends about the show. I'll be right back. Tell your friends. Hey, folks, Dr. Joe here. So glad you spent a little time with me today. We're talking today about diseases that can adversely affect your love life. Now, a big thing that I hear often is men will come in and say, I have low testosterone. And it's very common. I hear it a lot. Now, what men don't make enough testosterone, the male hormone testosterone, may find that if that's the case, their love life may be in neutral. Sometimes it's due to a problem with the brain that tells the body to make testosterone. Type 2 diabetes, liver disease, that can make it more likely that you're low in testosterone. You can do a blood work on it and find out what's going on. But what you want to do is find out what you can do about it, because if you take testosterone as an injection, again, I'm not against that if you need it, but whenever you take something from the outside, your body stops producing it internally, and that can become an issue. So what if we can get your body to start producing more of your hormones, testosterone, estrogen, progesterone, whatever it is? So the one thing we want to look at is your adrenal glands. The adrenal glands, if you cut them open, they have 3 layers. They look like a little walnut. And you cut them open, 3 layers, and one of the layers produces adrenaline, and one of the layers produces what's called pregnenolone, which becomes DHEA. And if your body's functioning normally, the DHEA becomes your sex hormones. If you're under stress, instead of the DHEA becoming your sex hormones, it becomes cortisol, which is your stress hormone. So if you're under a lot of stress, that could be a reason why your body is not producing the right amounts of testosterone. Now, what kind of stress is there? There's chemical stress, food, drugs, alcohol, environmental toxins. There's physical stress, pinched nerves, muscle spasms, pain, emotional stress. So the chemical stress and the physical stress, you can have control over. If you have pinched nerves, come see us. Let's see if we can fix the pinched nerves. If you're not in the area, I know the show's heard all around the world. Our main offices are in the Atlanta area, you can go to a doctor near you. Get the spine checked. Find out if there's pinched nerves. Chemical stress, you got to change that. Go to my website, drjoe.com, and click on my videos. We have so many hundreds of hours of audios and videos. And on YouTube, we have a link to our YouTube channel, and you can watch some of the lectures that I've done. And the lecture I'd recommend you watch is The 7 Deadly Sins of Nutrition. These are the 7 foods you want to avoid that can be causing chemical stress. And then there's another link on there, and it's an audio only. It's called So What Can I Eat? You can listen to that as well. And the cost for that is nothing. It's no charge. Go to my website. It'll say blogs, and it'll say, I think media, actually, and you can watch it there. And you learn the foods that you can eat and not eat. It's real simple. It's real easy. Read my books, Eating Right for the Health of It, Prescription for Extreme Health. A lot of good information in those books. Real easy to read. I write the way I talk, actually, real fast. And I write fast. You got to read fast. It's very important. You got to read fast. And just silly jokes in there, too. Hopefully you'll enjoy it. And you'll find out what to eat and what not to eat. So you can address the chemical stress. And then don't do things like perfumes and hairsprays and deodorants and colognes and new car smell, air fresheners. If I take my car in to get it washed, what air freshener would you like? I'm good. Thank you. I don't want those artificial chemicals getting in my body. Room fresheners, carpet cleaners, those are all chemicals that can adversely affect your hormone levels and get the adrenals. We have Dr. Joe's Adrenal Support. I take it every day. And it's funny, I was looking, we had a informal reunion, so I was watching on Facebook people taking pictures, and I'm looking at some of these folks going, who are these people? I have no idea. I see the name, it's like, no way. Man, time has not been their friend. So, what are you laughing at, Ahmad? You're going to get old someday, you know. Trust me.
This is true, but you're making these comments. You're not going to be invited to the next reunion.
Well, they don't know who I'm talking about. Some of them look good, so yeah.
True.
So just assume if you're listening from my old high school that you're the one that looked good. But you can really slow down the aging process dramatically and keep those hormone levels up by not poisoning yourself. A lot of the things you're doing that speed up the aging process are active. You have to actively eat bad food. You have to actively expose yourself to chemicals. Passively, by not doing things, you can really increase your health levels and your age dramatically, how long you live. So just do the right things. I take Dr. Joe Super Greens, Dr. Joe Essential Source every day. And boy, that's been a gamble that paid off for me. Years ago when I developed it, I started taking it, and I said, man, I hope this works. Sure has. This stuff's amazing. The energy levels and how much better I feel and how much better I sleep. And like I said earlier, sometimes patients miss it, and they'll go, oh, man, I just don't feel right today. I missed my Super Greens and Essential Source. Relatively inexpensive. Go to my website. Look at it. Try it for a month. What do you got to lose? You've spent money on stupider things. Go out for 1 or 2 drinks. It's going to cost you probably the same amount that this. Well, maybe a few more, 1 or 2 drinks. But those are on the website, though, drjoe.com. Also available on Amazon. It's like 17 different types of fruits and vegetables, prebiotics, probiotics, digestive enzymes. It alkalizes the body, has salts in it for iodine. Most of us are very deficient in iodine. And that can help with your hormones. Because in order to make a hormone, you have to have the raw materials. And if you're not giving the body the raw materials, it can't make anything, whether it's a hormone or eye tissue or toenails or bone. You got to give your body the stuff to grow. And that's why we created Super Greens and Essential Oils and a lot of the other supplements as well. Menopause can become an issue when it comes to romance. It's a natural time in a woman's life. Your estrogen levels drop. And what happens is, as your estrogen levels drop, your romantic organs don't work like they used to. And so that can be a big issue. So if you're having hot flashes, if you're having trouble in the romantic department, there's certainly medications you can take, but maybe try a non-medical approach. There's something called chaste tree. You might want to try that one. Get the adrenals working. Okay, we have a whole, if you call our office, we can put you on we can do a hormone panel on you. We can test your hormones and see where you are, and then we can advise specifically a supplement protocol for you. And we can do hormone panels. We can do, a patient came in the other day, she went to China, and she was having real bad digestive problems since going to China. So we did a protocol, testing on her. We're waiting for the results to come back to see if there's any parasites. And if there is, well, then we have to go ahead and address that. As far as lubricants go, how about coconut oil? Coconut oil is a natural oil that can act as help in that area, because a lot of the commercial things that women use have hormone-disrupting chemicals in them. Isn't that ironic? And so you don't want to put something in your body or on your body that isn't going to work very well. That's why extra virgin organic coconut oil works really well. Might be something you might want to consider. Multiple sclerosis. MS affects your nervous system, which can affect your brain, which can affect your romantic desires. Remember, your brain sends messages to the rest of the body, and if the nerves aren't working properly, you can't get the message to where they're supposed to go. But here's the thing. A lot of people take artificial sweeteners, specifically aspartame. And one of the side effects of aspartame, well, several of the side effects, mimic multiple sclerosis symptom for symptom. And the reason is aspartame breaks down to 3 components: aspartic acid, phenylalanine, and methyl esters. Methyl esters is methanol. Methanol is wood alcohol. And wood alcohol poisoning mimics MS symptoms. And so patients come in my office, they had a CAT scan or an MRI. We didn't find what's called a white focal point or a white focal spot in the brain, but they're still diagnosed with MS. A lot of times that's aspartame toxicity or methanol toxicity because they're drinking diet sodas all the time or having diet foods in their diet all the time. So you got to cut out those artificial sweeteners, folks. Folks, if you have a question, we have one more segment. The number here, 844-44-Dr. Joe. That number rings through my offices when I'm not on the air. I didn't say it yet. If you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. I've never seen a car accident where the occupants weren't damaged. You need to come see us right away. If you want to order Super Greens, Essential Source, listen to my blog posts, listen to my podcasts, drjoe.com, or just Google Dr. Joe, and you can also order my products on Amazon as well. Hey, tell your friends about the show. I'll be right back. Hey, tell your friends about the show. Hey, folks, Dr. Joe here. Hope everybody's having a good day. Last segment of the show. Good news. If you missed the show, good show today, as most of them are. We're talking today about diseases and how it affects your love life, and everybody gets up in arms when I start talking about their love life, and they want to make sure they're getting the best they can. So if you want to hear this in hundreds of hours, probably well over 1,000 hours of other shows on my podcast, go to drjoe.com or just Google Dr. Joe. If you want to binge listen, you could do it there. Also, if you have Google, Stitcher, or iTunes, you can go to look up For the Health of It, Dr. Joe, For the Health of It. And you can also do that, and we release podcasts twice a week, and you can get those, get notices about that, so you could listen there. We want to get this information to you. We videotape a lot of my live lectures. They're on my website, too, drjoe.com. And you can watch a lot of videos. A lot of you are visual learners, so that's why we put videos up. And starting this week, we're going to start videotaping a lot of our shows. And then this show, come out September, October, is going to become a TV show, just like we do a Sunday morning show as well for a couple other stations, our sister stations. And we're going to record that starting this week, and then we're going to start recording this show, and it's going to be on Tough TV coming up real soon. So you'll be able to hopefully watch. You'll probably live stream it, too, so you can actually watch the show. And you can see how handsome Ahmad really is and how I look like Jerry Seinfeld, I guess. Right, Ray Romano. If Jerry Seinfeld and Ray Romano had a child, right, I would be there. Ahmad's laughing in there.
That's pretty accurate.
It's pretty right. Yeah, see? Right around Hanukkah. Oh, happy Hanukkah. And I was looking, I thank you. I'm Italian. I'm not Jewish, but thank you. I appreciate it. I want to have a happy Hanukkah, too. But, yeah, so Jerry Seinfeld and Ray Romano, if they had a child, I'm it. So we're talking today about pain and other issues that can affect your love life, diseases that can affect your love life. Of course, Parkinson's can be an issue. And a lot of times Parkinson is the brain, well, it always is the brain misfiring. And it could be due to a digestive problem. Not saying it is, but I've had a few Parkinson patients respond favorably because you have to break your proteins into amino acids, and the amino acid GABA, the amino acid glutamine becomes GABA, and GABA helps suppress neurological issues in the brain, nerves from firing off, and that's what Parkinson's is. You're just firing off nerves, sometimes arbitrarily, it seems like. So you want to make sure your digestive system is working well. And we talked a little bit about stem cells. There is some promising research in stem cells right now working with Parkinson patients as well. People that have bladder problems, could this affect your love life? Oh, yes, it can. So it's especially in women more so than men, and men have a longer urethra. So women, because they have a shorter urethra, that's the tube that goes from your bladder to the outside of your body, women get more bladder infections because the urethra is shorter and bacteria can get up into urethra. Men, the urethra is a little more elongated. It's harder to do that. But pressure on your belly can cause leakage, and of course that's not something you'd like to have during romance. And so people start to avoid that issue. Now, a lot of times when people have weak bladders, we check the nerve supply in the low back. That's the nerve to the colon, sex organs, and bladder. So many times when people have weak bladders or they have leakage, it's a pinched nerve in the low back. The brain isn't telling the bladder to contract properly. And another thing you can do, it's essentially Kegel exercises, which is contracting of muscles. So every time you pee a little, stop. Pee a little, stop. You're contracting those muscles and building up strong muscles again. Because as we get older, all our muscles get weaker. including the bladder. So working that is good for men and women when it comes to romance. It helps get better muscular control. So pee a little, stop, and if every time you pee, you do that, you're working out those muscles. Inflammatory bowel disease, Crohn's disease, celiac disease. Now, if you have these diseases, you usually think of it as a bathroom problem. I got to find a bathroom. I got to run to the bathroom. But it can be a serious issue. And certainly, you don't want to save embarrassment. You don't want to have any issues with the bowels if we're having romance. So what do we do about it? Well, many of those diseases respond very well to dietary changes. So what you want to consider is giving up wheat and dairy products. If you have any type of digestive problem, acid reflux, heartburn, burping, gas, bloating, you want to check the stomach, of course. Come see us and we'll check your stomach for you. But you can then take control as well. Give up all wheat and all dairy. Here's my challenge for you. Do it for 2 weeks, 14 days. No, not even a little bit, not a bite, nothing. Check ingredients, gravies, sauces. Sometimes they have wheat mixed in. No wheat, no dairy, and that's milk, butter, cheese, yogurt, eggs, ice cream, anything that comes out of the rear end of a cow. And cut it out for 14 days. See how your digestive system does. See if you respond positively. After that, I want you to go back to eating wheat and dairy. And a good way to come off this little wheat and dairy fast is to have some pizza, which has what? Wheat and dairy in it, right? And then see how you feel. Do you get gassy, bloaty, acid reflux, bad breath, mood swings? Does the digestive issues, the irritable bowel syndrome kick in? And if it does, you will then say, like most people, Dr. Joe was right, because Dr. Joe usually is right. And then you just have to avoid wheat and dairy products. And then if you do eat them, you'll suffer, because most people don't listen to me. They'll do it and say, oh my gosh, you were absolutely right. You're amazing. Wheat and dairy cause my sinus problems and my bloating, my gas, and my mood swings, and I'm going to cut them out. Until Tuesday when those donuts showed up at the office, those cream-filled donuts. And so I just had one because I've been such a good boy and I haven't had any. Boom, everything comes back. And then you say, Dr. Joe was right again, and you go back. And usually it takes a few mix-ups or mess-ups, and then you'll say, yeah, Dr. Joe was right. But many times we just need to relax and adjust, physically move around the digestive system. There's a valve between your belly button and your hip called your ileocecal valve. And if that valve is stuck open, you might have diarrhea. If it's stuck closed, you might have constipation. And so many times we just have to go in there. I can teach you to do this one. This is one you can actually do at home, is massage that valve and get it to relax. And when you do, then everything starts working normally again, and you're happy. And it's all about you being happy, isn't it? A patient the other day had post-traumatic stress disorder, PTSD. That's a pretty serious issue. If you've had a trauma in your life, whether you were in war or maybe you were attacked, you've been victimized, it can be scary. And so symptoms like flashbacks can feel like you're reliving the trauma. And if you have PTSD, you may feel fear of pleasure. It's a real thing. Mental health experts may help with that. But once again, just like with every other disease known to humanity, you want to make sure you have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. And many times, a lot of your health issues then are resolved. Say nervous system, of course, we talk about chiropractic. See if you have pinched nerves. And it's not just the spine. You may have a bone in your foot out of place. I can't tell you how many patients come to me and say, Doc, we've done everything for my foot and nothing is helping. And my doctors will check the feet. 1/4 of all the bones in your body are in your feet. And we put the bones in the feet back in place, and that stabilizes the knee, which stabilizes the hip, which stabilizes the low back, which helps the headaches go away. So 206 bones in the body, you want to check all of them. And we try to check as many as we can on our patients. We check for acid reflux, and then we get you on some good food. Certainly at least Dr. Joe's Super Greens and Dr. Joe's Essential Source. Minimum amount of supplements. And then we probably need to do a whole workup on everybody to find out what else you need. Folks, you're just tuning in. You missed an amazing show. It's going to be on my website, drjoe.com. Also, if you want to buy the supplements, those are available on the website, drjoe.com. Also available on Amazon. We want to get you well and keep you well. Hey, listen, I want to say this. Thanks so much for listening. If you want to make an appointment, 844-44-DR-JOE. Hey, tell your friends about the show. Thanks for listening. We'll catch you next time.